should you do is really the question. And there's some strategies out there in the medical arena, the different the monoclonal antibody drugs, what you should have at home to check yourself and to see if your health is deteriorating, and what nutrients you should be taking, what things you can do to boost your innate immune response, and things to make your house safer if one of your loved ones, someone in your family gets COVID, if you get COVID, what strategies you should suggest to them and when they should go to the hospital. So I put this presentation together. I'm going to move myself to the side here a little bit. And I'm going to make myself go disappear up into the corner here. And so what you want to do, so there's monitoring of medications, there's a pulse oximeter, there's monoclonal antibodies, there are vitamins and possible immune boosting nutrients, hypothermia, which we're going to talk about in depth about how to heat your body up, and preventing spread at home and filtration and air systems. Okay, so we had these happy hypoxics that first appeared in New York City. They seemed to be well, except that their oxygen levels were really decreasing. So what should you get at home? That this is known as a pulse oximeter that measures your pulse wave and something known as SpO4, which is your oxygen saturation. So just you want to put it on a finger. You want to make sure you don't have any nail polish on the finger. You don't want to get the first reading. You want to wait a couple minutes, and it will tell you what your oxygen saturation is. Very inexpensive. I mean, there are ones that are a couple $100s, but you can buy them at any pharmacy for $30, $40, $25, $30. They're very, very cheap. All right. And so 95 to 100 is a good level for oxygen saturation. If you get 90 to 95, that's telling me that you're in the yellow range, a little bit of caution. And if you drop below 90, then that's a reason for concern. And if you have shortness of breath and difficulty breathing, then you might want to get yourself into an emergency room situation and be evaluated and maybe put on oxygen, and worst case scenario, get put on a ventilator that will help you breathe. But what the virus does is it binds to the ACE2 receptor, that's the angiotensin converting enzyme receptor, and it attacked the respiratory tract and also attacked the cardiovascular system. And people had a hard time breathing because they weren't getting enough oxygen into their blood, or not enough oxygen into their cells. So this was the happy hypoxics that appeared early on in the pandemic. And so a pulse oximeter that you can buy online on Amazon pretty inexpensively, or you can get at any pharmacy, I think is a really good idea. Okay, so that's a pulse oximeter. And if you can't get one of those, you want to look for shortness of breath, cyanosis, which is blue lips, and tongue, which is a great way of looking to see if you have decreased oxygenation or hypoxia in your tissues of your body. There are a certain class of drugs known as monoclonal antibodies that have some very good research out there, and they're not widely used, mainly because doctors don't necessarily know about them. So if you are a patient who's been infected and you start to get oxygen saturation below 90%, you might want to get on a couple of different monoclonal antibodies. Now, the first one is made by Eli Lilly, and it's called bamlanivimab. 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 No matter how long I've practiced to say that, I really can't say that well. I don't understand how they come up with certain names for drugs, but bamlanivimab, I think that's the right way, made by Eli Lilly, and another drug made called Regeneron. That's a combination of casirivimab and imdemivimab. And those are monoclonal antibodies. And what they do is that they have a lot of research behind them. And basically, they'll bind to the spike protein on the COVID-19 and have an antibody to that, and then prevent the virus, the spike protein, to bind to the receptors on the cell. And so the goal is not to get the virus into the cell. And it's sort of how the vaccinations really work, by making your body make antibodies. So here, this is the studies that the SARS-CoV-2 neutralizing antibodies are in output patients with COVID-19. And it said here, these are phase 2 trials involving outpatients with recently diagnosed mild to moderate COVID-19 were randomly assigned 452 patients to receive a single intravenous infusion neutralizing antibody. So this has to be done in a setting that can do IV infusion. You can't go to your pharmacy, ask for a pill, and take it at home. You have to go to a place, which is another reason, because the clinic has to be set up to be able to do IVs, and so you have to be monitored to be able to do that. So here you see the SARS-CoV-2 virus, all right? And here you see the spike protein, all right? And then here you see these monoclonal antibodies that will bind to the spike protein, preventing them from binding onto the receptors of the cell. So this is a valuable tool if you're early on in the infection and you want to prevent the infection from getting into other cells. This is something that I would do myself if my oxygen levels were dropping low, I was having shortness of breath, and I really wanted to not have the disease progress any further. All right, and here you see, so once the virus starts to get into the cell, now you have an infected cell. Now you engage something known as the T killer cells. This is part of your adaptive immune response. They secrete something known as perforins, which perforate the cell membrane, and then you have these enzymes known as granulozymes that will go in and destroy the cell. All right, so you want your innate immune system to be able to work, and you want your acquired or adaptive immune system to be up to par. But the first line of defense is the innate immune system, and you want to prevent the virus from getting into your body into the first place. And so I'm going to teach you certain strategies I believe that will be very beneficial for you to help you do that tonight. And so this was on that study where they looked at the patients that were on the BAM, lemivimab, or the Regeneron. And so basically on day 29, the percentage of patients who were hospitalized was 1.6% in the monoclonal antibody group and 6.3% in the placebo group. In the post-analysis that was focused on the high-risk subgroups, an age of 65 years or higher, and a BMI greater than 35, that's body mass index, for an ideal for a person that's healthy should be between 19 and 25. So 35 is somebody that's pretty obese. The percentage of hospitalizations was 4.2% in the monoclonal antibody group compared to 14.6% in the placebo group. So that's a rather dramatic change. And I'd rather be in that 1.6% group as compared to the 6.3% group. All right. And so they opened this up to patients that are high risk. Now, if you see, it's a lot of patients, all right? BMI greater than 35, which is pretty obese, but chronic kidney disease. I mean, people can be thin and have that. Diabetes, there's a lot of people out there that are diabetics. There are thin diabetics. If you have immunosuppressive disease or on immunosuppressive drugs like Humira or Remicade, current receiving immunosuppressive treatment for an overactive immune system. If you're over the age of 65, these are all patients that are can definitely go on. So patients 55 years and old with one of the following: cardiovascular disease. That's a lot of people that have had cardiovascular events, coronary artery disease, hypertension. That's a lot of people in that. Other respiratory disorders, chronic obstructive pulmonary disorders. If you have a BMI in the greatest 85 percentile for their age, so somebody that's pretty heavy, sickle cell or congenital heart disease or neurodevelopment disorders. So, so why are the monoclonal antibodies rarely being used to treat COVID-19? And this has all been on the news, but without it, I don't know how much worse it would have been, one patient said. And this was just from December 2000 and December 2020. So you have to be your own best advocate. If you end up in the hospital, you go, "Doc, I need a monoclonal antibody." All right. And persist for that. You have to push or have your surrogate, somebody that's there with you, your public defender, your public patient advocate, fight for you to make sure that you are treated with the most state of the art equipment and being in the hospital. So again, monoclonal antibodies, if your oxygen saturation is below 90% and you're trying to prevent yourself from coming down with a more severe case of disease. All right. And here you see this was on from NBC News, a godsend or not worth the effort. Monoclonal antibodies divide overwhelmed COVID doctors. Some doctors are cameling over the treatment, which officials say in some places is sitting unused. So, a lot of them end up sitting on shelves in hospitals and not being used. So be your advocate. Okay. Now, a lot of the information that I'm giving you here is from a Dr. Roger Swalt, who is quadruple board certified, sees patients, COVID patients in 2 hospitals in Southern California. And they have a online program known as MedCram. So you can go to medcram.com or you can just Google it and it'll come up on YouTube. And they have put out updates since the beginning of COVID. So right now, I think they're on to update 120. They put on a lot of special webinars. Every month or so, they'll put out a good hour program that will concise all the information that's been coming out to everybody. So if you really want news to use, it's you get this from MedCram. This is where I get the majority of my information, also from the Institute for Functional Medicine, as well as a certified member. We've been on top of this since the beginning. So these are the nutrients that I would use for prevention, and then I would rev them up if I tested positive. All right. So vitamin C, and we're not really sure of the milligram dose, but at least 1,000 milligrams a day. I know that if I'm under the weather, I'm going to take 3,000 milligrams a day, maybe even more. All right. And you want to get a buffered vitamin C so you don't end up with gastric upset. Vitamin D, your numbers should be between 60 and 80 nanograms per deciliter. I myself take 5,000 international units per day. The government recommends that you don't go over 4,000. I take 5,000. Quercetin there's not a tremendous amount of research on all these nutrients where you have double-blind placebo-controlled studies, but there's a lot of studies out there that show the effectiveness of these nutrients for immune support. So quercetin works as a zinc ionophore, drives the zinc into the cell and kills the virus within the cell. NAC, known as NAC, is a precursor to something known as glutathione and quells that oxidative burst in the mitochondria of the cell and prevents that inflammatory cytokine storm. So NAC is a nutrient that I take quite regularly because it does make glutathione, which is a last resort antioxidant and actually pulls heavy metals out of your body. It's very good for your brain, very good for your liver. And so it's inexpensive, NAC. It's available in most health food stores. Most of the top professional brands that I use it. I like to take glutathione because your body has to convert the N-acetylcysteine into glutathione, and I like to take the NAC and glutathione. We know that sleep is very, very important, and 7+ hours a minimum. And so a lot of people have a hard time sleeping. And we know that melatonin might work for some people. It might not work for other people. So I would take 3 to 5 milligrams an hour before sleep at night. And the research actually shows that the sleep before midnight is a much better sleep than the sleep after midnight. So early to bed, early to rise makes a man healthy and wise, or something like that. All right. And so sleep is very, very important. We know that people that get the vaccine, any type of antibody therapy, that it will work better if your body sleeps. All right. So respect that. And I would make your body sleep and do whatever you need to do to sleep, even if it's a pharmaceutical for short term. But I just had a conversation with a patient, and it was Tylenol PM every night. And that's not a good thing because that's going to deplete glutathione after doing that for a prolonged period of time. And now you just lost one of your major antioxidant systems in your body, known as glutathione reductase, and you don't want to do that. Zinc, of elemental zinc, and up to 40 milligrams a day, not more than that. And you want to be conscious of that, because you might take a prostate formula that has zinc in it, and you might take a multivitamin that has zinc in it, and then you might take a thyroid formula that has zinc in it. And next thing you know, you're up at 100 milligrams of elemental zinc, and that's a little bit too much, and it becomes toxic to you and deplete copper. All right, so these are my main nutrients that we can give a patient in one simple packet. One of the major companies that I work with has made an immune defense pack. The company is called Metagenics. They're a top quality, top tier nutritional company, one of the best. And they have all this in a simple packet for not a lot of money, except the melatonin. So you can take that. I would take one packet a day. And then if you got infected, I would up that to 2 packets a day. All right, this was the SHADE study. So there were 2 major big studies that came out of India, and another study that came out of Spain. The SHADE study was out of India. It's a short-term high-dose vitamin D supplementation for COVID-19 disease in a randomized placebo-controlled study. And the results were dramatic as an immune modulatory. So vitamin D is an immune modulatory role, but the effect of therapeutic vitamin D supplementation in SARS-CoV-2 infection is not known. So we know that it's an immune modulator. We're just not sure around COVID-2, all right, because it hasn't been around long enough. But I would rather see you be on the safe side, take the vitamin D supplementation. Most patients above, I believe it's the 39 latitude, are vitamin D deficient unless you're supplementing with vitamin D. And every patient that I've seen, unless they're supplementing, is low in vitamin D. I take 5,000 IUs a day. During the summer, you're out in the sun. Maybe you could take a little bit less, but it could be summer and you could be inside a lot. So don't be scared to take vitamin D. Very, very rarely. I've only seen one patient have high levels, and then she was taking 50,000 IUs a week for very extended periods of time. And then I checked her vitamin D levels, and she was at 150, and so that becomes very toxic. So as far as a fat-soluble vitamin D is very, very important. There are some people that want to be restrictive around vitamin D, so that's somebody with sarcoid. I would be conscious of that. And the research really shows that there's synergism between vitamin D and vitamin K. So I would add the vitamin K into a supplement with vitamin D. I think it's about 45 micrograms of vitamin K, menaquinone, MQ7, with 5,000 IUs of vitamin D. So most of the better companies make a combination formula of that. And magnesium is also a very good nutrient to go along with vitamin D and vitamin K. And I like it in the form of magnesium glycinate or magnesium lisinoate, but a chelated form of magnesium would really work best. Vitamin K, you need to be careful if you're on blood thinners like Coumadin or Warfarin. So again, just a little caveat: if you're going to be treating yourself nutritionally and you have other comorbidities, you want to clear it with your medical doctor or your healthcare provider, maybe a naturopath, or an osteopath or your chiropractor, and to make sure that you're okay. Let somebody guide you. Just don't take these things yourself. Again, so you can go to medcram.com, go to episode 59, and they will give you the information on prevention. All right. And basically the same nutrients for prevention are the same nutrients that I would use if I got COVID-19. There are certain nutrients that if I took, I would probably stop because they can, boost your immune system and have maybe a negative effect on you. And that would be things like maybe echinacea and sambucus and things like that. So I would take them for prevention, but I would stop them if I did get infected. Okay. And here you see above I think the 39 latitude. So anybody above the line here would, be prone to vitamin D deficiency. And so that's like the Mason-Dixon line here in the United States. Okay. So basically, this is what happens with the disease. You're healthy, you get infected, and it takes really about 5 days for the virus to replicate and multiply where you've become symptomatic. And this is where the problem is that patients can have the virus and not know it. and have it for a good 5 days before they even become symptomatic, if they become symptomatic. And those symptoms, those first 7 to 10 days, is crucial. So this is really where you need to intervene if you have not been doing prevention. But this is so you prevent yourself from getting into a hospital situation and you're a admission into the hospital. So day one, admitted, and then you see shortness of breath, and then you see acute respiratory distress syndrome. So these are things that we want to prevent progressing. So the next part of the presentation here is how to prevent yourself from progressing from very mild symptoms to ending up in the hospital. Okay. And so you get infected, and 80% of the people are going to respond well with no intervention at all. I've seen plenty of patients that have had COVID and boom, they're fine. There are some people that have had COVID and they still have some symptoms. Isn't that right? They have fatigue, they have shortness of breath, they have respiratory problems, and those are called the long hauls. And we could save that for another presentation. In the hospitalization, they might use, some steroids, a convalescent plasma therapy, remdesivir, and the goal is really to prevent death. All right, because these patients here, a certain 20%, some will end up in the hospital, some will end up in the ICU, some will end up on a ventilator, and some unfortunately will not make it home. We don't want to be one of these. All right, and the goal is really to get you here. And so there's a couple of things here that I'm going to go through with you now that I think could really be very wise to do. So if you look at here, we have two parts of the immune system. We have the innate immune system, and here you see in this red box here, natural killer cells, which is part of the innate immune system. And then we have the adaptive immune system. So the innate immune system is that this is a built-in, God-given defense mechanism that we've got from the beginning. And you see here macrophages, dendritic cells, eosinophils, basophils, mast cells. All right, and these monocyte and natural killer cells. So we want to be able to make sure that our natural killer cells are as robust as possible. And unfortunately, as we get older, our immune system is not as robust as it was when we were in our adolescent years and teenage years and our early 20s, which is why very rarely you see younger people succumbing to COVID, but there have been, and there may be other comorbidities, but there are outliers. Of course, nothing's 100%. So what can we do to improve natural killer cells? Now, here on the left, you see something known as IFN, and that stands for interferon. So that's exactly what interferon does. It interferes with a virus replicating. Now, COVID-19 interferes with interferon, and it allows the virus to replicate. So we want to have a robust interferon. And there are certain things that you can do right now, today, to boost your interferon levels so that if you do come in contact with COVID-19, you nip it in the bud before it takes hold. So interferon is sort of like an alarm system. If your cell gets infected with the virus, it sends out interferon to other cells in the surrounding tissues to let them know that they're under attack and mount your troops on the border. We're being invaded. All right. And so the virus prevents that from happening so the virus can take hold. All right. So we want to be able to have interferon levels to be very elevated. And here you see this is immune responses in COVID-19 and potential vaccines, lessons learned from SARS and MERS epidemic. And here you see active viral replication later results in hyperproduction type 1 interferon and an influx of neutrophils and macrophages, which are the major sources of pro-inflammatory cytokines. So basically, these macrophages destroy the virus within the cells, all right? So you want to be able to have a robust immune response. And then down at the bottom here, it says the immune response is a critical factor for disease outcome. So we know that patients that have a more robust innate immune response decrease their risk of ending in the ICU. All right. And so here you see type 1 interferon response in COVID. So thus, it can be that patients most susceptible to severe disease are those that cannot mount an effective antiviral immune response. All right. Interferon responses could explain susceptibility to severe COVID-19. All right. Patients with more severe disease had less type 1 interferon activity in the blood. Type 1 and type 2 interferon responses were highest in patients with mild and moderate disease and low in patients with severe or critical disease. So again, want to raise our interferon levels. So this study shows here is that the interferon, the higher the level, all right, in mild COVID-19, all right, and severe, and then critical. So the worse the patient is, or the more severe the illness is, and the more severe the activity of the virus, the lower the level of interferon. All right, and this is from Science, which is a great journal, and this is just August of 2020. So this is just a couple months ago. So this is as recent as it gets right here, is that we want to be able to boost our interferon levels. And here you see is that together these two papers explain nearly 14% of severe COVID cases. Is quite amazing. Is that inborn errors of type 1 interferon immunity in patients with life-threatening. So some people might have like antibodies to their own interferon, making their interferon useless. All right. And so we have inborn errors of interferon. And so we can have some mutations involved with that, lowering that your interferon production. All right. So what can we do? What can you do as a patient to increase your interferon levels? All right. And here's a paper. All right. Human monocyte stimulation by experimental whole body hypothermia. Hypothermia. So what's that? That's heating your body. So when you get a fever, that's hypothermia. So we want to mimic fever. All right. And so this study, what they did is they took patients, volunteers, and they immersed them in 39.5 degrees hot water bath. So 39.5 degrees Celsius is 102 degrees. All right. Which mediates the initial attachment of leukocytes to the endothelium during inflammation, downregulation after hypothermia. Comparable changes in monocyte receptor expression were observed. So basically, you improved your interferon, you improved your natural killer cells with exposure to heat. And this is very well documented. Now, we don't have enough documentation to say that warming your core temperature up is going to prevent you from getting COVID. But there's enough studies that have been done in the past on other upper respiratory viral illnesses that show that heating the core, heating up your core temperature, is a great way to raise your natural killer cells and increase your interferon levels. Okay? And so here you see a sauna. Now, there's different types of sauna. There's a dry sauna, which usually runs somewhere between 178 and 188 degrees, 190, depending on the sauna. And then there's the Finnish sauna, which is a dry sauna that has rocks and you throw water on it. So it gets humidity. So it's actually a little bit more intense. But the dry sauna and the Finnish sauna heat up the ambient air. They heat up the air on the outside. So they heat you up from the outside. They're all good. The bottom line is you want to sweat. You want to get a good sweat and you want to raise your core temperature up. And you need to do about 20 to 30 minutes to do that, of sitting in a sauna. Now, I prefer myself something known as a far infrared sauna. It runs at a cooler temperature. It's a more gentle heat. It resonates your water molecules inside your body. So it's not necessarily the heating element that makes you sweat, but it's the light form of the far infrared rays that penetrate your body and resonate your water molecules and heat you up from within. We know that if you're in the sauna for about 20, 25 minutes, you start to raise your core temperature to about 102 degrees. So if a patient has a fever and you end up in the emergency room, you end up in the hospital, you get admitted, unless that fever is getting above 103, 104, you want to be kind of reluctant to treat that fever, because it's your body's innate response to your body's innate way of killing the virus. All right. And so here you see immune changes in humans during cold exposure. So it seems that any type of stress, whether it be heat stress or cold stress, is a good way to generate natural killer cells. Okay. And so this says right here in this particular study that this is the duration of cold exposure, 0, 60, 120 minutes. All right. And the longer you stress your body out with cold, the better that it is. And it says here, this study suggests that despite popular beliefs that cold exposure can precipitate a viral infection, the innate component of the immune system is not adversely affected by a brief period of cold exposure. Indeed, the opposite seems to be the case. The fall in core body temperature results from cold exposure led a consistent and statistically significant mobilization of circulatory cells and increase in natural killer cells and elevation in of interleukin 6 concentrations, which is an inflammatory marker. So we can see that this is a very good study, and you want to raise your natural killer cells. All right, so that's a good thing to do. So a hot sauna followed by a cold shower or a cool shower. And that seems to be the way that really to boost your innate immune system from within. So I like to use the sauna, and I find that I don't have any research that specifically on COVID, but I find that that's my COVID protector right there, is using the sauna every day. Now, I was using saunas for quite a period of time after listening to a podcast from Rhonda Patrick. She's a PhD. She has a very beefy podcast known as Found My Fitness. And she was speaking to a group of cardiologists at the Arkansas Heart Hospital, suggesting to them that they should start prescribing sauna use for their patients with cardiovascular risk factors or cardiovascular disease. And she went through the research on that. So after hearing that, I decided to start using the sauna, make it part of my workout. Well, then COVID came and the gyms closed, and I felt like I was missing a vital part of my own cardiovascular program, as well as an immune response program. So I was at a conference in February at the Integrative Healthcare Symposium in New York City, and I ran into Phil Wilson again, who I've seen numerous times, who has the Relax Sauna. And when I first saw the Relax Sauna, I said, it looks kind of flimsy. I'd rather get one of those big, nice wooden saunas. But I sat in it for about 5 minutes. I was dressed up. I went in, I took my sport coat off, I took my shoes off, and I sat in the sauna for about 5 minutes. And I was convinced right then and there. I said, wow, I didn't sweat. You start sweating around the 8 to 10 minute mark, and then the floodgates open up. And so since that point, I've added sauna into my practice. I have patients that will come in and use the sauna in the practice, but you're best off having one at home. You can use it first thing in the morning. You roll out of bed, just get right in the sauna for 20 minutes, or I do it at night. I'm going to do it tonight, and I'll sit in the sauna for 25 minutes. I can meditate. I watch a little bit of TV. I thought I could read, but I'm not reading in the sauna because it's too hot, and my glasses, they get sweat on them. And so I'm not doing that anymore. So I'll just either meditate, I'll listen to music, or I'll put a movie in, or I'll do something that's not going to irritate me, like the news. I find that the sauna is your COVID defender right here. So hypothermia in human enhances interferon synthesis and alters the peripheral lymphocyte population. Well, what more do you want? All right. And this was a very good paper right here. Induction of hypothermia in volunteers and immersion with warm water rapidly alters the cell population in the peripheral blood. So if you don't have access to a sauna, can you use a bath? Yeah, you can do hot baths, but you have to stay in it long enough, and the water has to be hot enough that you raise your core temperature. How about a spa, like a hot tub spa? Well, they have a limit on them. I think it's 104 degrees. So, and then you stick part of your body out once you start getting hot. But when you're in a sauna, you're in the sauna, and you stay hot and you sweat. What's nice about the relaxed sauna is that your head is out and there's no warm-up time. Actually, you say, I want to go in, and you just go in, and it gets hot. And with 8-10 minutes, you're sweating profusely. I've had numerous patients purchase the saunas, and everybody loves the sauna. I mean, nobody's coming to me going, oh, and I got people say, I use that thing every single day. And not only for COVID, but it's got tremendous cardiovascular research behind it that it improves longevity. If you use the sauna once a week or 4 times a week compared to once a week, you reduce your risk of having a coronary event or a stroke by over 48%. There's no pharmaceutical drug that's going to do that. Eastern Finland, the Kuopio study, huge studies, Yuri Lakinen, where they really looked at, I think, 2,300 men for over a period of 20 years of using sauna use, which is inherent to people of Eastern Finland. It's part of their culture. They would sit in the sauna and then they would jump in the cold water. So, and it's been used. Ancient Japanese have used the sauna, and Native American Indians, the sweat lodges. So a sauna has been around for a very long period of time. And just until recently, we discovered why it's so very beneficial for you. But prior to that, people just know they felt better innately, that it was a real good thing. Okay. So here you see, following mitogenic stimulation, which is mitosis, lymphocytes from hypothermic individuals produce as much as a 10-fold more interferon than cells withdrawn at basal core temperatures from the same individuals. And I told you before that in severe infection, people had very low interferon. In very mild infection, they had higher levels of interferon. So a temperature threshold of 39 degrees Celsius, that's 102 Fahrenheit. So you need to stay in the sauna long enough to raise your core temperature. It's 20 minutes, 15 minutes is okay. It might make you feel good, but it's not going to raise your core temperature. No change was noted in the activity of the macrophage population. The possible involvement of interleukin in this enhanced production is discussed. No changes were noted in the circulating levels of interferon alpha. Okay. And here you see core body temperature, all right, interferon. So the higher your core temperature, right, at 39, it's 102 degrees. So here you're at 100 degrees, or 101. Is that 102.5? You see the difference, the amount of interferon released from lymphocytes after mitogenic stimulation at different body temperatures. So you need to raise that temperature of your body up, and in this relaxed sauna. Now, when I first saw this sauna, and I'm going, it looks kind of flimsy here. How can this really do it? You just got to sit in it. Now, there's two different models. This model right here is the silver model, and this retail for $1,400. Now, you go on Amazon and you can look at saunas and see one for $500. It's not the same. This puts out 98.5% pure far infrared. Some of these other ones might say full spectrum infrared, so it's going to have near, middle, and far. It's the far infrared that penetrates your body. There are two semiconductors on the floor that have these computer chips in it that are made in Taiwan. This is Japanese therapy known as Weion therapy. And this is a nylon tent that has silver in it, which makes it expensive. So basically, it's not at 180 degrees. It's going to go up. And so it reflects off the whole tent, off the floor of the tent, off the ceiling of the tent, off the back wall, and is penetrating your body 360 degrees. It goes about 1.5 inches into your body, resonates your water molecules from within, and you detox from within. People notice white speckles on a white towel or a light colored towel when they first start using the sauna. That's toxins coming out of your body. And you're relaxed from here. It doesn't beat you up. All right. There's 2 heating elements. You can put one on at a time. My father in his 96 in his last couple of days, I put him in the sauna. My office manager has her son. He's 3 years old. He goes in the sauna. I have patients 5, 6 years old. They go in the sauna with an adult. Everybody loves the sauna. It makes you feel real good. So we know that it's great. It causes human growth hormone burst. So it prevents muscle atrophy and causes muscle hypertrophy. It causes lipolysis, which is fat burning. You detoxify heavy metals such as mercury, aluminum, cadmium, which is in cigarette smoke. We know that cadmium induces arthritis. So you get it into your joints. All your joints start feeling good because you're detoxifying in your joints. So again, it's not the heat even though the heat feels real good and you're sweating, but it's the light form, and I'll explain that to you right now. So this is what we see from the sun. You have gamma waves, X-rays, ultraviolet, visible light, infrared, microwaves, and radio waves. And then this middle part here is infrared, and you see near infrared, medium infrared, and then you see this far infrared over here. And then there's this tiny little part of the far infrared that's 4 to 14 microns that we know that penetrates us. So when you're sitting outside and the sun is beating on your back, what you feel is that far infrared heat energy going into your body. That's what feels so good. And that's what the plants use for photosynthesis. It's the light of life. The relaxed sauna gives you that light of life. You're not going to get that in a cheap imitation, $100, $200, $500 sauna online. It's an expensive piece of equipment, but they're a workhorse. They'll last, patients have them out there 10, 12 years with no problems at all. Right. And if you need to get another conductor, very inexpensive. It's portable too. They fold down and it weighs 18 pounds with the chair. And you can take it with you. You can fold it down, you put it on a plane. So it's a very good thing to do. And it's a very good thing to take with you when you go away. Now, we know that fever is very good for you. Here you see Julius Wagner from 1850 to 1940, introducing fever therapy in the treatment of neurosyphilis. So here you see, noted that insane patients with generalized paralysis occasionally became sane after febrile episodes. So what he did is he infected them with malaria and they got better. Now, he won a Nobel Prize for this, right? And here you see in the following years of discovery, artificial fever was induced by the following methods: by parasitic diseases, injections of chemical substance such as sulfur, electrical means by the administration of diathermy or radiothermy, and simple immersion of the individual in a hot bath or placing him in a heat cabinet. So the heat cabinet is a sauna. All right. And so now we know this Japanese therapy, this far infrared therapy. And there's a very good book, and it's written by Sherry Rogers. It is known as Detoxify or Die. And the book was written in the early 2000s, I'm going to say 2003, on the benefit of far infrared sauna that she does a lot on there. And I've used that book religiously with patients to explain sauna to them. All right. So the sauna makes you better. It's just not good for COVID, but it's good for everything, just about. All right. So this is what they did. And they did this back in 1918 in the Spanish flu, is that they would use hydrotherapy with patients. They would put hot packs on them, followed by cold, hot packs by cold. And the patients that they did that on in the sanitariums, compared to people that were in the army camps, did much better. And the sanitariums were the predecessors to modern day hospitals. So therapy was highly admired and used on neurosyphilis cases into the 1950s. But then the year after he won the Nobel Prize for this, the penicillin came out, and that kind of got pushed to the wayside because we started going more for the drugs. It was more glamorous, right, to go for a drug than to go sit in a hot box, a miracle drug. Okay. And here you see, penicillin, miracle drug, soon out of in patent forms, but best see the doctor first. The wonder drug, chief physician reports an effectiveness against infections. New curative is expensive and supply small. Okay. So again, is that we want to be able to prevent somebody from going from this early stage onset into the late stage. Okay. Oop. I did something wrong. Let's see. All right, back. Okay. All right, and prevent death. All right, so this is Dr. Roger Swalt. And again, he's quadruple board certified, pulmonary, critical care, internal medicine, sleep, medcram.com. I can't stress the importance of this. If you're a healthcare provider listening to this and you want really good information on how to do ventilation properly, how to read an EKG, how to do a chem screen, a tremendous wealth of information, and he's a great communicator. in giving you this information. So kudos to Dr. Swalt. A lot of these slides I was able to, to grab from his presentations. Anyway, and then a couple other things you want to do. So if you have somebody infected in your house and your house is really sealed up and you got really good insulation and you got the windows closed all the time, and you got the heat cranking, that's not a good thing. So you want to have air come in and air go out. You want to open the windows up. If somebody's infected, you want to be able to put them in a room by themselves. We like air ventilation systems with the MERV as a rating system of filters that 50 out 50%. 20% of the small particles. Filters like a MERV get you closer to 80, 90%, or HEPA filters, 99.9%. So we have HEPA filters that we suggest to our patients. And the building that I have my office in upgraded their filtration system to these high rating MERV 8 filters into the office. So you don't have to worry about the air filtration in the office. So, and then we know that the masks are not 100%, but they work to a certain extent, is that they prevent large respiratory molecules from leaving your mouth, going a distance, and then inhaling by somebody else. So I'm all in favor of masks in certain situations, but they're not a panacea, and I want you to be conscious of that. So if somebody's infected, you need to stay away from them for a period of time. We've been doing COVID testing in the office. We do the PCR testing. We can turn it around in 1 to 2 days. So patients have really been having a hard time getting the PCR testing done, is that they have to make an appointment online, and then they have to wait when they get there, and then they have to wait a couple days, 5-7 days to get the results. We're able to get the results in 1 to 2 days. This is not the rapid test, but this is the PCR, the polymerase chain reaction, where it goes through the nose. And we use KBMO Labs. They're outside in Massachusetts, and they're a high complex CLIA certified lab, and they do great quality control. So if you have a negative, you know that it's negative, and if you have a positive, you know that it's positive. All right, it's very specific for COVID-19 and not other coronaviruses. So high complex lab, and we do the antibody testing as well, where we can look at IgM and IgG, and I can do that in the office and get those results back in 2 to 3 days. Okay. So this is the air filtration that we recommend. That's very moderately priced for patients, and it's loaded with, carbon filter, perma filter, great HEPA filter. It's just very good, and patients really seem to like that. All right. So we're going to put a couple of links into this as far as I think the nutrients that I believe that I take myself religiously. I'm looking to see if I have it on my desk here, but I do not. And as well as the sauna. So you have questions, feel free to email me at the email address below. And I appreciate your time in listening to this, and have yourself a great day and stay healthy. Again, thank you very much for listening. Dr. Scott Banks here. Have a great day.